Hello, everyone. I'm Dr. Francisco. I'm live in YouTube once more. This is part of this video series for kidney health information, kidney disease awareness, to help patients, their relatives, their loved ones to understand more about kidney disease so they can manage the disease better, take more meaningful discussions with their own doctors so they can minimize complications and worries and also expenses. But this doesn't replace a doctor. You still need to see a doctor if you have a problem, or you can consult me. I have my clinic in Singapore. I provide also telemedicine services. But the aim is just to empower you to know more so you can understand a little bit better your disease and be more empowered with self-care. So I give some tips on prevention of disease, prevention of complications, or simply what I want is you are on top of the disease and not the other way around. But let's go to the topic. Let's go to today's topic. Is a new one. We're going to talk about polycystic kidney disease. So what is polycystic kidney disease? I will mention a little bit of the definition and some of the characteristics and some of the symptoms. Autosomal dominant polycystic kidney disease, also called ADPKD, or for short, polycystic kidney disease, is a relatively common inheritable disease due to mutations in genes that normally maintain the right anatomy of the microtubes of the kidneys. But when they are mutated, the micro and macro anatomy of the kidneys are disturbed. Thus, those mutations cause progressive deformity of these microtubes and cause their enlargement into balloon-like structures called cysts, which are filled with some sort of fluid. I'm going to show you my model. This will be a normal kidney. A kidney with polycystic kidney disease will be larger than the normal kidney, and it will be filled with these structures, balloon-like structures that are the cysts. They don't work. So the kidney, the functional kidney, gets replaced by these cysts. So that's why the patients can develop kidney failure. Also, they push the tissue that normally works and cause some inflammation as well. So that's why patients, unfortunately, can develop kidney failure. The most common mutations affect the chromosome 16, and patients who suffer this mutation, unfortunately, tend to do worse than patients that suffer the second most common mutation on chromosome 4. There are other minor mutations in other genes. I'm not going to mention them. The kidneys are not the only organs that get affected. Also, the liver, the pancreas, the epididymis in the testicles can have cysts. The brain can also develop aneurysmal dilations in its arteries as well, which can potentially rupture and cause brain bleed with all what that means. Imagine that this is the brain. The arteries also can get dilated in the same way of the cysts. And because the wall of the arteries get weakened, get thin, they can rupture. In the gut, there could be also some dilations like that are called diverticula, some sort of sac-like malformations that can also cause problems. Maybe there are patients that they don't have any symptoms, but they can lead to problems like infections, rupture, or bleeding. There can be also abdominal hernias. A hernia is a weakening of the abdominal wall in between the muscles. Because of that weakness, some of the gut loops can pass through. Some patients can see a bulging. Some patients can have some pain, or the gut can be trapped inside and can cause obstruction or worse problems to the gut. The heart can also be affected. There can be valve disease. The valves can get a little bit dysfunctional, sort of floppy, don't close properly, some insufficiency. The coronary arteries, the arteries also that fill the brain, imagine that this is the brain, they also can get dilations. They can also rupture, which can be disastrous. When we assess patients as a doctor, we need to take into account all those potential complications, considerations. So like we try to investigate them, or if the patient have a funny symptom, we probably think, oh, could be maybe a diverticula, or could be maybe start with some headache. What if it is a minor problem, or maybe could be a aneurysm that start giving a problem? And we can act and discover it and intervene earlier rather than to wait until there is a frank um, brain bleed that can put life in danger. Regarding these brain aneurysms, it's important to mention that patients who are considered for transplantation, they need to be, work out for them, because otherwise can introduce some extra risks. So I hope you find this useful. Remember, I'm doing this in Facebook Live as well. Now I started doing this live in YouTube. Please, as they say here, smash the like button. Please comment as any questions. Share the existence of this group. Subscribe. Put the notification bell. At the end of the day, this is just to help you, give you information, so that you are more equipped to have more meaningful discussions with your doctor to understand their disease. So, as I mentioned, to be on top of the disease, not the other way around. So you have potentially a longer and fuller life despite your disease. Whatever disease is, could be diabetes, could be other diseases of the kidney. So my aim is to that, and give you some extra tips for prevention or better control of the disease as well. So I'll see you in the next session. We will be continue talking about polycystic kidney disease. Remember, I also provide consultations by telemedicine worldwide, or in my clinic in Singapore, or house calls in Singapore as well. So I am Dr. Francisco, wishing you the best possible health. Take care, guys. Bye-bye.